All right, I think we have a quorum. So thank you everyone for joining us this afternoon. I'm Erica Palmer from HST Pathways, and I'll be moderating the discussion today. Before we jump in, just want to go over our usual housekeeping items. First, as you likely heard, this event is being recorded. So either later this afternoon or tomorrow, you'll receive an email from us with the link to the recording, so you can replay it or share it with your colleagues. And then it will also be available on HST's website in a few weeks as well. And second, hopefully you know this by now, but this webinar really is for you, and we want this to be as interactive as possible. So we did receive some questions during the registration process that I'll make sure we cover, but please use the Q&A box at any time if anything comes up, and I will make sure to get those in front of our speakers at the right time. So what are we doing today? We are in the middle of our welcomes and intros. We're then going to switch to our interactive customer discussion, where we'll talk to folks from the Urology Group on their experience with HST Clarity. And then Pierre will take it from there and wrap up with a demo. So here are the speakers we have for you today. I'm really excited to have both Glinda and Ruthie on the call with us. I'll give them the opportunity in a minute or two to introduce themselves, but they are longtime users of HST Clarity and have been wonderful clients. So I'm excited for them to share their experience with all of you. And then me and Pierre are on the call as well from HST to kind of guide the discussion and then show you HST Clarity in a little bit. And this is just, again, very high level. Pierre will do a much deeper dive, but if there's anybody on the call that isn't familiar with what HST Clarity is, here's a very high level. Basically, it's a pretty robust tool, that patient estimation tool for your staff, so they can create quotes for scheduled patients. So very quickly, it allows you to generate the quote in minutes, send the quote to your patients via text or email, and then start collecting upfront payments as early as possible. So just to kind of set the scene on what the product is, this is what we'll be diving into today. Okay, so enough of me. Let's get started. Glinda and Ruthie, can you share a little bit more about yourselves and the Urology Group?
So my name is Glinda. I've been with the Urology Group for 23 years, 8 months and 9 days. So I've got a
Who's
lot of
counting?
history here, right? I should be counting down, to retirement, but here I am. So I've been here since basically the beginning. We're getting ready to have our 25th anniversary, and it has definitely grown from the days where you allowed patients to pay $5 a month, until they until they went in the grave and you were never paid for the rest of it. To now we do the pre-collections, and we have been doing pre-collections for several years, even prior to getting HST, but we do really enjoy the product. So I started out, doing insurance follow-up and ended up where I'm at now. So Ruthie, you can go ahead and say a little bit about yourself.
Hello, I'm Ruthie. I have been with the Urology Group for about 5 years. I've been in this department for about 4 years, running benefits for patients for their outpatient surgeries and collecting money and running their benefits.
Awesome. And what is the average monthly case volume for you guys?
Monthly, I would say between 800 and 1,000 cases monthly.
Okay. That's pretty impressive. And how long did you say, so I know how long you've been with the Urology Group, but how long have you been using HST Clarity?
So we started using HST during the pandemic, like right when it first started kicking off. It was May, I think, of that year, May of 2020, that we actually started. Might have been June of 2020. So we've been using it since then. Obviously, the receipts were down a little bit during 2020, but each year they've picked up. We're back to full force as we were before the pandemic era.
Nice. That's awesome. And you alluded to this a little bit, but when it comes to like the financial estimate piece of it, what was your day-to-day like prior to using HST Clarity?
I'll let you answer that.
Day to day before, prior to using Clarity, was it was very time consuming. We would have to print the orders out. We would have to verify eligibility and benefits for patients using the insurance websites. We would have to manually calculate and figure out the amounts, the estimated amounts for the patients. So it was very time consuming before, and we had to call each and every patient.
How much time do you think you were spending going through that process and creating the estimates?
It would take about 15 minutes, about 15 to 20 minutes, depending on how many patients we pulled. If we pulled about 15 orders, it would take about 20 minutes.
And so 20 minutes to pull the orders, or 20 minutes, was that 15 to 20 minutes per patient to create the estimate?
Per patient was probably about 5 minutes each patient.
Gotcha. Okay. Gotcha. And with the estimates you were creating, did you find that they were accurate?
They were pretty accurate. I feel like using Clarity now, it's a little bit more accurate. But before, it would just be based on using the insurance websites to get those eligibility and benefits.
Gotcha. So it sounds like the biggest pain points were the manual piece of it and just kind of the tediousness of it, and then the time it was taking per patient as well.
Correct.
Okay. So you create the estimate. What was, how were you then getting the estimate to the patient? I know you said you called them. So was that a phone discussion every single time?
Yes, it was a phone discussion for each patient. We would have to call each patient. Either we would speak to them or leave them a voicemail, but you had to call every single patient.
Yep, I know, and I think we all understand the struggles of that back and forth
Yes.
tag and dialogue.
Yeah.
Okay, so, and then how about, okay, so you give them the estimate over the phone. Were you able to do any upfront collections with that process, or was it more like, here's what you owe, we'll see you the morning of?
We would try to collect up front, but most of the time it would just be they'll come in and they'll either make a payment when they get here, or they'll make a minimum payment.
Yeah, that makes sense. What other, besides like the manualness and the tediousness, what other pain points about that process just weren't working for you that kind of, were kind of driving you to start looking at solutions?
Well, I can answer that. I think that we weren't able to do the volume of cases that we can now. I mean, as far as providing care, yes, we could do that volume of cases, but we weren't collecting on every single case because we just didn't have enough manpower to work all the cases for every day. And even today, there are still some cases we don't do, such, an emergency add-on or something. You're not going to ask the patient for money, the day they got it out of the schedule. But just being able to collect as much as you can up front really does help on the back end as far as number of bills you're sending out, patients being dissatisfied because they had no idea how much it was going to cost them. Those were the pain points. Patients calling in after the surgeries being very angry about their bill, how much it was, and also not being able to collect upfront on 90% of our cases.
Yeah, and that's huge. That the patient satisfaction piece of it we'll talk about in a little bit, but that's without that word of mouth referral and without satisfied patients, it's really hard to grow and scale and have repeat patients if necessary and things like that. So I totally understand why patients get frustrated at times. Being a patient and consumer myself, it's tricky. So, okay. Anything else you would like to share about your life and processes before Clarity, before we move on?
Well, I did see here someone posted about the secondary payer. Prior to using Clarity, it was a little bit tricky because you had to figure out the benefits for the primary and then the secondary. Then you had to do the manual math, calculator, and figure it out. With Clarity, it just made it so much more easier because it does the math for you and it works up the benefits for you. So using Clarity definitely helped out a lot with the secondary payer, if that answers the question.
Yes, I think it did. Perfect. And if it did not, please feel free to follow up in the Q&A as well. All right, beautiful. Just for the sake of time, let's switch gears here. So you get to the point where you realize you're ready for a new solution, or start researching. Where and how did you begin researching your options for automating this process?
So actually, our CEO, if I'm remembering correctly, it's been a minute, but our CEO had run into Chris Finelli either at a conference or some industry event, and they had known each other from years past, and Chris approached him about this product. So we set up a meeting. Chris went through the product with us, had conversations internally after that meeting. I think we probably met with him 3 times where he went through the product. Obviously, as the people that were going to be using it, we were super excited. We're like, yes, this is going to be great. We can do more work. It'll be less painful. But then, there's the cost involved, so we had to work that out. But once we decided to go with it and we actually went live, implementation was very easy. We began with 2 of our workers using this product. Everybody else was still doing it the manual way. We had a little bit of pushback from employees. People don't like change. They get nervous, not sure if they'll be able to do it. All of those things that go through your mind when there's a big change coming. But I will say that over time, they have grown to love it. And of the employees that are new hires, they didn't know the old way. So they just think it's great. They really like using it. They find it easy to use and accurate. So, but of course, you got to think garbage in, garbage out. You got to make sure you give HST your contracts so they can load them and you get accurate results back as far as what your out-of-pockets are going to be.
That's actually a perfect segue because this was one of the questions that came in during the registration process. Someone had shared a lot of our staff are older and are not comfortable with new software, and we require more trainings than I think most would. Was it easy for your staff to pick up?
Yeah, I would say it was very easy for them to pick up. And, if there were additional questions after training, there was always staff at HST that were available to answer questions. We had internal people that would help them. And I have a lady now, I think she is 73, and she loves it. She was a hoarder. She had files and stacks of paper everywhere,
Yes.
and notes, and she is entirely paperless now. She loves it. So I don't think that age should be a deterrent for taking on this product. Anybody can learn it, from your young employees to your older employees.
Yeah, that's awesome. And it's interesting that it came from the CEO had kind of initiated the conversations internally, because I feel like we see a lot of the times like the actual users are the ones who are trying to drive the change internally, and it can be really intimidating to be the one like spearheading this new technology, this new change in process, and the people around you are like, don't rock the boat, even though they agree with the pain points. It can be intimidating to be that person internally who's like, no, we must change this. And then,
Right.
you're kind of going up, trying to convince other people as to why you need it. Yes, there's a cost, but here's going to be the ROI and how much
Right.
easier our lives will be. So I love that it came from the CEO and everybody was on board.
We're very, very lucky here. Our CEO is very approachable. He walks around the building, makes sure he says hello to everybody every day. He's
Yeah, that's awesome. So we did get a question, says, how do you deal with contracts? I'm assuming that is referring to uploading the contracts to HST. If that is the question, Pierre, will you be covering that a little bit in the demo later on, or do you want to address that right now?
I'm happy to cover it myself, but I think that Glinda and Ruth could probably speak to their experience building and maintaining payer contracts with our team as well. I think it'd be better for them to speak to that.
Yeah, great.
okay. So what we did is we sent our contracts to our contact at HST, and they are loaded there by them, and then they maintain them. You just have to send in a help desk ticket and say, hey, this CPT is changing, and then each year when we do usually 3 to 4 year contracts with our insurances, we'll send them the new contracts, and then they load them for us. So we didn't have to go in, and it didn't take any time at all for us to do it. We just had to provide the contracts to them, and then give them the nuances of it. This insurance pays 1 procedure per day. This one, for your multiple procedures pays 150, 25, or whatever those nuances might be, and they get them all loaded for you, and then all you have to do is plug in the numbers and button, and it spits out and tells you how much the patient's going to owe you.
Perfect. Thank you for sharing that. That question came in anonymously. So if you have any follow-up questions, again, put them in the Q&A box and we can dive a little deeper. Anything else about the implementation process that you'd like to share?
No, I don't. But I do see Lexia has put changes on there on one of the questions. Do you mean if a procedure changes after you've already done the quote? Is that what you're speaking on? Maybe you could clarify for us.
We'll give her a second to respond. But it might have just been standing in solidarity with the difficulty of changes. I'm not sure.
Oh, gotcha. Yeah, that's
Right.
perfectly possible. Right.
Oh,
Okay. So, Ruthie, I don't have anything else on implementation. Do you?
No, just post implementation. It was a learning curve in the beginning with clarity, and like Glenda said, change is change. It takes time to learn new things, and we've grown to love it.
perfect.
Mm-hmm.
All right. So switching gears, you've gone through implementation, you've gone through all of your trainings. I have some of your quantitative results over here to the right, but tell us, you shared a little bit, but like what is your day-to-day like now that you get to use HST Clarity instead of having to go through the manual process?
Oh, the day-to-day process. Sorry.
Yes, please.
I thought that was a Glenda question. The day-to-day process right now, you're asking. The day-to-day right now, it's a lot easier. It's less complicated, less time-consuming. The team, we pull the orders and put the names on a spreadsheet. We go to Clarity to run the benefits and eligibility, and it's like we get it in seconds. Like as soon as we click on it, it comes up. We send the text and or email to the patient, and they get it in a matter of seconds. I can be on the phone with the patient and see if they call back, said, hey, something's changed with their insurance, and I can say, okay, well, let me fix that, and it instantly does it, and I'll say, okay, well, I'm going to send you this text or email, and they'll get it as soon as I'm on the phone with them. So it's been really easy for the patients to get their estimates, and it's been really easy for us to use it to send to them.
Love it. And can you speak to some of the results over here to the right that you've experienced since? And then you said, so you've been on the platform for about 3 years, right? And these are kind of the
Yeah.
results that you've seen. That's awesome. Can you speak to any of these and share a little bit more?
Well, I mean, they're pretty self-explanatory there on the right-hand side, but, you know, basically our upfront collections did increase a lot. It's $1 million annually that we're collecting upfront. And I'm sure anybody on the call who's interested in this knows that if you don't collect it upfront, it's very difficult to collect it on the back end. Medical bills, and rightfully so. I don't blame people for it. They kind of are the last to get paid. You got to feed yourself, house yourself, and have a car. But to get that money up front, that definitely then drives down the amount of accounts that you're sending to collections. So annually, we were sending roughly about 1.1 million to collections. After starting using HST, that has gone down to about 550,000 annually. So still, it's a big amount, but it's definitely at least half than what we were sending. Another savings point was we were able to decrease our full-time employees or in the department, and that wasn't for anybody who's scared out there. Oh, I'm going to lose my job. That wasn't through that. It was just through attrition. As people would leave, we just wouldn't fill the position. So I don't think that anybody felt any pain and like, oh, I have to pick up their work now, because the volume of the work is such that it is definitely doable by 4 people. And if somebody goes on vacation, you know, they just pick up a little more and they come back and everything's good again. Also, I think patient satisfaction has definitely increased. They know up front what to expect, what their out-of-pocket's going to be. And even if they call and they say, oh, we can't afford to pay that full amount, we have ways that we can work with them where they can do a deposit and be put on a payment plan. And then, of course, there's other procedures that we consider elective, and we're say, well, at a time when you or we can even schedule you at another facility. We offer other things such as care credit to our patients, so they can, you know, finance their care up front and then have payment plans with an outside source. It definitely has decreased the amount of angry calls that we get post-surgery. So
Yes.
It's been great. It has been great. It's been less pain points for our employees, our patients, and, you know, the doctors and the owners. They're just with how much less we're sending outside collections, and even how much the patients that come in and complain about the bills to them in the office when they don't really can help them with that. So everybody's happy all around, I think, financially and being able to spend more time taking care of the patients and not talking to them about their bills.
Yeah, and it's interesting with the whole patient satisfaction piece. It's like it's such a shame because you could give like, and you do world-class care. They have the best experience. They have the best outcomes. But if they're stressed about the financial aspect, your satisfaction surveys are going to plummet regardless. So,
Yes.
and that is like, you know, aside from anesthesia and other stressors, it's like the financial piece of having a procedure done is so stressful. So to be able to remove that element is huge. And the other thing you mentioned that I think is interesting, you had mentioned like when people go on vacation, and it reminds me of the woman you mentioned earlier who had all the sticky notes and all these, you know, papers around her. It's like the expertise is not left on, you know, the burden on one person who just has all the information in their brain and just from years of experience. It's while you definitely have your super users, if someone does go on vacation, the process doesn't change.
Right.
Correct.
Exactly. And I see a question that's asking about the EMR. So we also use a different EMR than HST. So you can use Clarity and not use the HST EMR. In fact, we actually just switched to a new EMR, and it also is able to work with Clarity. So yes, you can use a different EMR. And then as far as what we include in our estimate to the patient, it gives them what they're scheduled for. It tells them what the charge is, what the allowable is, what their estimated portion is going to be, whether that's their coinsurance, copay, deductible. We also include a little blurb on there that tells them that this does not include anesthesia, any radiology charges you may have, so that they're not surprised when they get those ancillary bills. Do they always read it? No, but we do include it on there. And we did actually just recently start doing our radiology, so CT scans are now included on there as well.
Awesome.
Right. And they're also able to make a payment. There's a link on their patient view where they can make a payment directly to for their procedure. And then also on the care credit that you mentioned, there's a link that'll go straight to our care credit link on the website. Yeah, where they can just click right on there and just apply, and their payment will go straight to us.
Perfect. Yeah, thank you for sharing that. One question that came in during registration, is it easy to track on the back end who has paid and who hasn't?
Well, in our old system, it was not really that easy to track because it was limited in the amount of kind of reports you can run. But in the new system that we have, it will be a lot easier because the payments will be posted at point of service, so we'll know who paid and who did not pay right away.
Perfect. Thank you. All right, just for the sake of time, going to our bonus questions here. How has your experience been with customer support at HST when you've needed it?
My side of things, where I'm more on the managerial side of it, it has been great. Anytime I've had a problem, I reach out. If it's not an immediate response, I have a response before the end of the day. Maybe the response isn't, that it's fixed, but hey, we're aware of the issue, we're working on it for you, and they're very communicative. I can let Ruthie speak about, because I think, you can send, if an estimate comes back wrong or it's pulling the wrong benefits, you can send that to them and they work on that for you. About that a little bit.
Definitely. So on the estimate, when we're sending it, if there's something wrong on there, we can just hit the feedback button. We send our response and then our note, and they'll send us an email within a couple hours. And they're very responsive. I haven't had an issue with them at all.
Great. Glad to hear it. And how do you envision HST being a long-term partner with you?
We love HST, so we have no plans on going anywhere else.
Yes.
Long term, we actually have a meeting set up, I believe it's next week, to go over possibly expanding this. Right now we're just using it, but we're using it for our ambulatory surgery center that we have. We do all of the surgeries here. Do the quotes both for the physician's portion of the procedure as well as the facility portion of the procedure. We also do the physician's portion of procedures that are going to be done in the hospitals, and we've started doing for the CT scans. So next week we're having a meeting to discuss, further expanding that and doing maybe even the procedures that are done in the physician's office. Possibly even, office visits, collecting those copays up front before they even get to the office, things like that. So, we'll have to see what comes out of that. But, we do look forward to a very long relationship with HST.
Awesome. Love to hear it. As we're wrapping up, no other questions have come in, but again, please put them in the Q&A box if you have them. Is there anything else you would like to share? Your favorite features or just any general insight or common hesitations you hear, whatever you would like to share?
I'll let you share. I don't really have anything.
Yeah, I think it's a really great tool to use. Like I said, if a patient has an insurance, if they have a secondary insurance and we didn't know, we can instantly add that in there and then just go ahead and get the eligibility and benefits in a matter of seconds. So that's nice to have. And just, I think it's a great tool. Most of the time, everything is pretty much, accurate. It's technology. Everything's not perfect, but I mean, it's way better than what we used to do with the day-to-day papers and calculator and trying to figure things out. And so I like it a lot. I think it's a great thing.
Perfect. Well, thank you both so much for sharing your insights and experience. I'm sure a lot of people who are joining us today can relate to some of your pain points pre-clarity. So